Hey, good afternoon. My name is Jeff Patterson. I'm the Chief Executive Officer for Nacogdoches Medical Center and the EMC Health Network. Today, we're holding a webinar where we can talk about the Affordable Care Act and our Marketplace Initiative to help people gain the enrollment that they need for their health coverage in 2026. I'd like to note, as you can see on the front of this slide, this is a partnership that we brought together of healthcare providers who are interested in you gaining coverage. It involves Nacogdoches Medical Center, Nacogdoches Memorial Hospital, East Texas Community Health Services, SFA, and Agility Insurance Service. High level, wanted to talk through what the marketplace is, who can qualify, and how you can go about learning more about your options for coverage. When you look at the marketplace plans, one, you need to live in the United States. Two, you need to be a naturalized citizen. And an important point to note would be that you can't be covered by Medicare, Medicaid, offered insurance through your employer, and that also includes your spouse. And then lastly, you can't be incarcerated, but those are the main qualifiers for being able to get a marketplace plan. You may have heard in the news, there's been a lot of talk about the Affordable Care Act and these enhanced tax credits. The enrollment period started on the 1st of November, so we are currently in the enrollment period, and that will run through January 15th. Now, if you would like to have coverage beginning in January, you're going to need to have the enrollment completed by December 15th of 2025 for coverage that will take place on January 1st. After that point, January 15th will be when open enrollment ends, and I believe that will give you coverage starting February 1st. But our timelines are very tight. There's been a lot of changes, and we want to make sure that you're well educated on what your options are. Today, I brought a specialist with me, Ms. Chelsea White. She works with us at Nacogdoches Medical Center in our business office, and she's going to walk you through some of the tax credit and cost sharing reduction changes that have happened, as well as some of the qualification limits. Chelsea?
Okay, thank you, Jeff. The premium tax credits and the cost sharing reductions, the APTC is what they shorted down to. Those are taken in advance to lower your premium cost monthly, or this can happen on the back end as well. You can pay the full monthly premium, and then when you file your tax return, you get that back at the end of the year. The ones that are eligible for tax credits is based on your household income and your family size. The income limit is between 100 and 400% of the federal poverty limit. Our cost sharing reductions, this lowers the out-of-pocket cost on deductibles, co-pays, and co-insurances. To be eligible for this, you must have an income at or below 250% of the FPL, which is the federal poverty limit. You have to be eligible for the APTC, which is the Advanced Premium Tax Credits, and you must pick a plan in a silver category. Those plans have extra savings. Those are your plans that you're going to have more copays on. You're not going to have to pay the deductible up front. You'll have copays for doctor visits and etc. Unless you are a member of a federally recognized tribe. This is a guideline that you can follow. It's based off of your household and your yearly income. So what you are expected to bring in for 2026. Below are your out-of-pocket maximums for each plan. It will give you the silver plan, what your income level is, and how much your out-of-pocket premium is going to be on an individual versus a family. The expected premium contribution, this is more for how much you're going to pay each month. This has gone up with 2026. So each percentage is different this year. And then the employer sponsored insurance, it used to be based on just individual coverage. Now it is based off of a family coverage on what the tax credit offers for the employers.
So Chelsea, just for some of the folks that are reading about this in the news, when you go back here and you look at the federal poverty guidelines and where they go up to, what would be the biggest change that you've seen or you could articulate to them as far as what's covered or how much is covered, or does it have more to do with what this expected premium contribution?
The expected premium contribution. So it's really based on honestly how many are in your household. If you have one person versus two, you're just from experience doing one that is a $0 premium monthly with one person in the household, it has gone up since then. Almost everybody is looking to have a premium this year.
No, thank you. And that's, what we're hearing. Chelsea handles these applications at our facility almost exclusively and spends a good 30 plus minutes with anybody who's looking to get the information and get re-enrolled. And so, again, just wanting to be able to articulate some of the changes for those people who are interested in more information. Do you want to talk about how they can apply a little bit?
Yes. Okay. So you can apply yourself on healthcare.gov. You do have to create an account. And it is pretty self-explanatory. When you get to the insurance, you will have multiple pages of insurances, and sometimes this is where people run into issues on choosing a plan. So that is where you can call. You can call us. We can help fill out the applications, review the choices, and help you enroll. There's also there's a local help button on the healthcare.gov. You put in your information and it will send to a certified application counselor or a navigator.
Thanks, Chelsea. And we got some other information we'll show here in a bit. What documents and what information are they going to need to ensure that they can have a prompt or a successful enrollment?
When coming to apply, always have your state issued driver's license or ID. With the yearly income, we need at least one of the following. There are many others that are on the list. We just added a few. Tax return, pay stubs. If you're self-employed and you have no employees, just your Schedule C is fine. A social security statement if you're on disability or anything like that, or an unemployment benefit letter. A social security card of those that are applying. If they're on the application but not applying for coverage, we do not need your social security card. And if you are a lawfully present resident or with a federally recognized tribe, we need one of the following: a passport, an LPR card, your certificate of naturalization or your citizenship, a tribal enrollment card. Again, there's many different items that you can bring. These are just a few of the top ones.
Thanks, Chelsea. And this is super helpful as far as explaining to me and to those who are interested in learning more about how they can have a successful application. We have two more slides. The first one, it just shows who you can contact. So if you're looking at this webinar later, obviously you just met Chelsea here on this Zoom, but we've got navigators from Memorial Hospital, as well as East Texas Community Health that you can reach out to. And so the contact information is there listed on the PowerPoint. Lastly, we are going to be hosting a Marketplace Q&A on the 2nd of December at the SFA School of Nursing on North Street. We'll again have all of these partners as well as our partner broker agility services there to either explain or help get you enrolled in your potential insurance for 2026. Again, we appreciate y'all taking the time today to learn more about the Affordable Care and the exchange and how we can assist folks with their enrollment this year. Thanks and have a good day.
Thank you.
And stop record, I guess.